Good evening, everyone, and welcome to this HEE Dental Review of Competency Progression webinar. I'd like to thank those in advance who submitted questions to us for the webinar tonight. We will be answering many of these questions as we go through each of the presentations. I just would like to say this is an HEE specific webinar. We may not be able to answer any questions specifically for those in training in the devolved nations. I am joined by 6 colleagues tonight. They are from HEE, Peter Briggs, Postgraduate Dental Dean for London, Kent, Surrey and Sussex, who is the Lead Dean for Dental Foundation Training. James Spencer, the Postgraduate Dental Dean for Yorkshire and Humber, who is the Lead Dean for Specialty Training, and Andrew Dickinson, the Postgraduate Dental Dean from the Midlands and the East, who is the Lead Dean for Dental Core Training. We are also joined by Claire Wilson, who's a Future Leaders Fellow at Yorkshire and Humber and an ST3 in oral surgery, Rachel Goldsmith, who's the Trainee Representative on the Dental Core Training Advisory Group, and Susie Welford, who's a Clinical Leadership Fellow and STR in Paediatric Dentistry. Before we get on with the presentations, just a little bit of housekeeping. There will be an opportunity to ask further questions throughout this webinar. You can do this by going to the Slido website, and you can see the link on the slide. You also would have to put an event code in, which is shown on the slide, #DentalRCP with no spaces. We will only be taking questions on reviews of competency progression during this webinar, but we can arrange further webinars if there is other subjects you are keen to have webinars on. So please put that on the Slido and we can take note of that if you have any ideas. As this is being broadcast to many people, we aren't able to answer questions on a personal or individual circumstances, but we'll try to answer as broadly as we can. The webinar will be recorded for those unable to join live, so if you know of anyone who can't make it tonight, they can keep their eye out on our social channels over the coming days for the recording. We know there will be a lot of questions tonight, but we are hoping to limit the webinar to approximately 1 hour. If we don't get through all the questions in that time, we'll gather the remaining questions and provide answers on our website. I'm just going to cover a few questions before we go on to the presentations that are fairly generic and not specific to any training programme. So the first question we had was, will trainees, either foundation, core or specialty, have further training opportunities in the specialties unit they were supposed to be in if they have been redeployed, i.e. if COVID outcomes have been given? So in answer to that, every effort will be made to try and catch up on any missed training, accepting that this will not always be possible. If a curriculum requirement, this may affect progression and will be identified at interim and final reviews of competency and included in a development plan. Second question, if competency or targets aren't met in both March or summer, what would be the next step? Well, if the competency target is a curriculum requirement, then it would have to be met to gain a satisfactory outcome at the review of competency progression. So it's dependent really on whether you're a foundation, core or specialty trainee as to the outcome. And this probably will be covered more in the presentations. The third question was, how will competencies be assessed? Well, they'll be assessed in exactly the same way they usually are, through the training portfolio by the review of competency progression panel, through work-based assessments, through direct observed procedures, patient feedback, 360-degree feedback, your reflections and evidence against curriculum requirement, and importantly educational supervisors' reports. I'm going to now hand you over to Peter Briggs, who'll provide an update on foundation training. Peter.
Thank you very much, Jane. Good evening, everybody. My name is Peter Briggs and I'm speaking on behalf of Dental Foundation Training. Next slide, please, Helen. We and I understand that many of you are concerned about progression within dental foundation training. The hope of this evening is to reassure you and answer where we can queries that you may have around your current training. The goal, as has been mentioned, of Health Education England is where possible to support a successful progression of training, and again where this is possible. Your progress will be reviewed by an interim and final review of competency progression panels, that's IRCP and FRCP, as suggested by the Dental Blue Guide, and these processes in relationship to you as your trainees will be in absentia, so you will not be attending these yourselves. Satisfactory completion of training will follow recommendation of an Outcome 6 in Dental Foundation Training FRCP later in the year in July 21. An Outcome 6 will allow the issue of a certificate of satisfactory completion in Dental Foundation Training and allowing you to progress satisfactory from training. Your IRCP panel reviews take place in late February or early March of this year. Next slide, please, Helen. And the IRCP panels can, in 2021, recommend a COVID 10.1 outcome. And this will be to reflect evidence of significant COVID disruption in your training. This was not needed in 2020 because that preceded the pandemic. Supplementary guides will be available to support the 10.1 COVID outcome. These are currently in the final stages of approval and will be made available to you, the trainees, the education supervisors, and the panels, IRCP panels, when the information has been approved. The scope and range of the IRCP checklists in the AXIA portfolio now encompasses virtually all of the areas in the IRCP recommendations and more. At the top of the checklist page, you will find a button that will allow you to download an Excel spreadsheet that will show the current status of your individual checklist. Although recommended outcomes from IRCP of 2 and 10.1 will signal unmet IRCP competencies, we would recommend that these outcomes are viewed positively by all trainees. By that, we mean as an opportunity to develop and grow towards the FRCP in July of 21. And that will happen with support of an agreed personal development plan, with the support of your education supervisor or supervisors and your relevant TPD. Historical evidence shows progress accelerates in dental foundation training quite remarkably in the last 6 months of training. Next slide, please, Helen. The IRCP recommendations have been approved by the Dental Foundation Advisory Group and deans of the English deans and deans of CopDent. They're relevant for all trainees undergoing IRCP and take into consideration the need to develop competencies as you progress within training. They also take into consideration the likely challenges within the NHS training practices, the agreed HE placements and front loading of education and didactic training that was delivered this year earlier in your training programme. NSBSA data in the background is encouraging in terms of HEE's dental foundation training. Although it is accepted, there may be some geographical challenges with that. Next slide, please. The IRCP panel will have the following outcomes available to them. An outcome 1 is where the trainee is progressing satisfactorily. An outcome 2 is a developmental or specific required competencies needed. And this will be, again, as mentioned, in combination with the agreed personal development plan, which should be supported by your education supervisor and your TPD. The COVID outcome 10.1 is a development of specific competencies, so it means there are unmet IRCP requirements or recommendations, and this has been as a direct impact from the COVID pandemic. There'll be a system of what records exactly the nature of that disruption, and as you'll see, the C3, C4, C6 and C12 subcategories to the 10.1 outcome. The outcome 5 is an outcome where there is not enough supporting evidence to make that the panel can consider and come to a conclusion with an outcome. Next slide, please, Helen. This is a diagrammatic representation of suggested uses of outcomes by the IRCP panel. So the evidence they will consider from each individual trainee, and then they will decide whether the evidence supports satisfactory progress. If it does, and all elements are outlined within the IRCP requirements, they will issue an outcome 1, which will signify that somebody is progressing satisfactorily, is on track. If the answer is no, and there are unmet elements of the 2021 IRCP recommendations, they have the option of an outcome 2, which is where there is no evidence or no strong evidence of COVID impact on the reasons for the unmet requirements, or an outcome 10.1, where there is clear evidence that the of COVID pandemic disruption as the major cause of any unmet competencies. Next slide, please, Helen. Your goal will be to achieve an outcome 6 at FRCP in July 2021. A COVID outcome will be available at that panel assessment. This will again identify the impact from COVID pandemic on your training. The Dental Foundation Training Advisory Group will review 2021 FRCP requirements in the near future with reference to impacts on general dental practices from COVID, and also the IRCP data and also the NHS BSA data in relationship to Dental Foundation training. These will be considered by CopDent and the English Deans in due course, and of course they must reasonably balance disruptions in training and clinical activity to the need for patient safety and assurance of independent practice. Where any decisions are made on reduced supporting evidence, the quality of the evidence available will be expected to be very high. Finally, from the presentation, I hope that you all enjoy the next 7 months of your training and achieve your goals. So what I'd like to do now, Helen, is move on to the next slide and answer, as Jane did, some pre-delivered questions that we'd received. So if I could answer the first two together. The first one is, will the UDA count be adjusted or removed from the RCP requirements? And the second question is, at present for Dental Foundation training, the UDA requirements for IRCP are 300 in the first 6 months. The message from the government is to stay at home and avoid any unnecessary travel, and as such a large number of patients are cancelling their appointments. Feedback from my colleagues on the Dental Foundation Advisory Group has been quite positive across the country in terms of general access to clinical and other training for our Dental Foundation trainees. We accept there may be some geographical variations to this. 300 UDAs was thought a reasonable output for Dental Foundation IRCP, although it is accepted that there may be some challenges for some in achieving this. It represents 15 UDAs per week over 20 weeks in your first half of training, up to your IRCP, which means if you have access in your dental practice to 5 days, it's equivalent of 3 UDAs a day, 4 days 3.75 and 3 days 5 UDAs. The situation and impact from COVID and government guidelines will be carefully watched and monitored over the next few months. That, as mentioned, the Dental Foundation Training Advisory Group will review requirements for FRCP very carefully, including UDA numbers in light of pressures on training practices, IRCP data and the NHS BSA data. DFT FRCP requirements must be balanced, as mentioned, and they must balance progression of training and the impact on training practice with the importance of patient safety and the quality assurance process of confirming that trainees are a safe independent practitioner. It is encouraging that the FD activity that sits within the NHS provider contract in England at present, and it's also encouraging that the minimum contractual requirement has increased from 20 to 45%. So it is hoped this will help us significantly in our goals. Question 3, DFT likely to be extended this year due to the current circumstances. The hope is that Dental Foundation trainees will be able to progress satisfactorily in their training where possible. There are no plans to formally extend HEE Dental Foundation training. We are committed to supporting trainees, however, who are awarded an outcome 3, which is an extension outcome at FRCP where they've been unable to fulfil the requirements, curriculum requirements of FRCP. And that support will be to allow them to satisfactorily complete their training. Evidence supports significant acceleration, as mentioned before, of attainment by Dental Foundation trainees, particularly in the last 6 months of training. Next slide, my last question. It's a long question. Trainees in a 2-year foundation schemes, e.g. GPT, lost up to 6 months of clinical time and practice during 2020 and worked for 3 to 4 months in 2020 with long fallow times and reduced patient numbers. When will information be released regarding their specific ARCP UDA targets? Will one UDA per triage logged encompass still be given as stipulated as IRCP targets? GPTs have approximately 15 weeks remaining in practice, excluding annual leave, and this clarification is required urgently given the very low UDA requirements for FDs of ARCP last year. This must be taken into consideration when designated UDA targets for GPTs. So this is an important issue that relates to those within GPT or joint dental foundation core training posts or longitudinal 24-month programs, whichever we want to call them. Trainees will have had a formal review in these programs by a panel with a recommended outcome in 2020. Therefore, some longitudinal trainees may be currently working to developmental outcomes supported by an agreed educational personal development plan. Triage activity and data, particularly in the COVID times, is very relevant for training and should be part, in our view, of the evidence reviewed at IRCP and FRCP panels moving forward. Satisfactory completion of DFT will require recommendation for an outcome 6 by the 2021 FRCP. The impact from COVID pandemic on training in 2019-20 would have fed into your 2020 review. The same should happen for 2020-21. Namely, the 2021 DFT FRCP requirements will be relevant for you to the equivalence clearly of the time worked within your dental foundation training in that year. Hopefully, GDS services will not stand down in 2021, and the big difference I think between this year and last year was that in general dental practice, services were stood down for a three-month period, and luckily at this stage there is no sign that that's going to be happening in England. So that ends my presentation and answer the questions. I thank you very much for the questions. Thank you.
So this year with dental core training, today's session is going to be centred around review of competency progression. There will be a bit of repetition as some of the same principles apply to both foundation, core and specialty training. But I have tried to largely make my slides in a screenshot friendly fashion to allow you to keep them for reference. I'll briefly kind of talk about IRCP, so that's interim review of competency progression, work-based assessments and e-portfolio as well. And then I will touch upon the final review of competency progression and some COVID-19 adjusted outcomes. So if you just bear with us a little second, we'll get that on there. So Helen, if I can go on to slide 3, that would be great. So just 2 down on that one. So trainees should steadily be building their portfolio throughout the training year and should be regularly meeting with their educational supervisors to ensure that they're on track. If I can just get the next slide, please. Trainee responsibility is to ensure that their evidence is available 2 weeks prior to IRCP, and essentially it's just a bit of a kind of light touch review. The kind of main thing, one of the main things to kind of be aware of at the moment is that the number of supervised learning events this year remain unchanged, and when compared to last year whenever they were halved. So essentially at this point in time, you should kind of really be halfway on your way to kind of RCP numbers. The other thing to highlight is if a DCT2 or DCT3 had been given an outcome 10 last year, so that's a COVID related outcome, they will also need to show evidence that their competencies have been met, as this probably should have been achieved by November 2020, but there's a little bit of kind of flexibility with that. So next slide, please. So essentially moving on to kind of final RCP checklist for 2021. again, the main thing to drive home is there is no adjustment this year in work-based assessment numbers. If you kind of look there at the number of DOPS, mini KEXs, case-based discussions, and developing the clinical teacher, it's important that you hit the 24, the kind of the normal number that's been there every year. Other things to kind of look at are making sure that you've kind of hit all the boxes on the new ePortfolio, so on Axia. So it's a bit of obviously it's a new platform and slightly different than Curas, but it's quite easy to see whenever you've completed something and haven't completed something, and certainly your educational supervisors and things like that will be able to see if you've hit those quite easily. Other things that you need to be aware of, and things that you need to have done at least 3 educational supervisor meetings, and a final structured educational supervisors report, which was brought around last year as well. It's quite straightforward and uses a template as kind of on Axia. Again, your PDP, personal development plan, must be completed, and some reflections on there as well, addressing what you've kind of completed throughout the year, and that will have been uploaded since kind of September time anyway. For the DCTs, involvement in teaching and research can be uploaded as well. It's not mandatory, but one of those things that I suppose if you're thinking about moving towards kind of specialty training and things like that, is quite important. The other thing to highlight is the clinical activity log, and make sure that that's on your achievement section. From personal experience, I would say if you haven't kind of been readily keeping a clinical activity log, now is the time to kind of get there, because it does take a while, and you don't want to be kind of scurrying towards the last couple of months of training and kind of having to get all those bits together from all of your clinical sessions. A clinical governance or quality improvement project, and attendance at mandatory study days as well, to be uploaded to the achievement section, and kind of tying in with the study days, a log of CPD as well. Multi-source feedback, it's quite self-explanatory on Axia as well. That all needs to be completed. And another thing, I suppose, from kind of experience, if you haven't kind of opened that up just now, I would definitely get that on the go, because it can sometimes take a while to get responses back as well. And then also a verified summary of satisfactory patient feedback. So I suppose just at this point, and I'll touch upon the COVID-related outcomes in a second, but the work-based assessments and supervised learning events that you've got don't have to be relevant to the specialty that you're supposed to be in. So if you have been redeployed, they just have to be relevant to the curriculum, and most things, if you're kind of thinking about them in a proactive way, can be and should be relevant to your curriculum. For example, cannulation skills, if you're kind of in a medical ward, medical conditions and relevance to dentistry, just kind of thinking a bit laterally outside the box. And I suppose as well, looking at this checklist for RCP, if you're looking at this right now and you realise that you haven't met many or any of these requirements, now is the time to kind of get the ball rolling, really. As far as kind of CPD and things goes, there's plenty of e-learning online to kind of get verified CPD. As I say about the logbook, make sure you're keeping a logbook as you go along. And as far as quality improvement projects go, as I'm sure everyone's aware, it takes a while to get a 2-cycle kind of project and get things through the hoops that they need to go through. So now is the time to be asking around, or perhaps looking on your trust's current clinical effectiveness register to see if there's any other projects that might be suitable. Next slide, please. So similar to DFT, we've got some new outcomes outcomes that were kind of introduced last year relevant to COVID. So outcome 1 is kind of what you're aiming for, which signifies your satisfactory progress and completion. And outcome 2 traditionally is given, and then you're given a time scale at which to kind of address a few things that you've perhaps not put in your portfolio, or perhaps some small oversights that you've not kind of put in, and any kind of evidence you'll be given a time frame at which to kind of upload those. Outcome 5 is insufficient evidence to decide upon progression. These are quite rare, and usually as if someone's not engaged with the programme. And the difference between kind of outcome 2 and outcome 10.1, which I'm just going to touch upon, is that the 10.1 is very specific to COVID and will be recorded as satisfactory completion, but that the competencies perhaps haven't been hit because of COVID or because of disruption kind of directly related to COVID-19, and those are kind of listed below. So the additional requirements that are kind of going from IRCP to RCP would be the multi-source feedback and patient feedback, and the final structured educational supervisors report as well. So the take-home message for kind of the whole presentation is, if you're looking at this now and you're kind of going, I'm definitely not on track for an outcome 1, now is the time to rectify this. Obviously, if you're redeployed and elsewhere, thinking laterally is definitely key. And obviously it's going to be slightly more difficult, but there are definitely ways around kind of making sure that you hit all the points that you need to hit. And just to kind of as a point of reassurance, out of the 754 DCTs last year, there were only 2 that kind of got outcome 2s, and the rest either got outcome 1s or COVID adjusted outcomes. So they're kind of, there's always a bit of a kind of activity flurry in the last couple of weeks, last couple of months. So now is the time to kind of get things on the go. So I'm just going to pass you over to Andrew, who's going to answer some of the questions that were posed with regards to DCT RCP.
Thank you very much, Rachel. We've actually had 4 questions around DCT as well. So the first one was asking, it is preferred for DCTs at all levels, particularly DCT 2 and 3, to have experience in research. This is incredibly hard to come by. Please, could you suggest some tips on how we could get involved in research? I think this is a great question, but before I answer it, there's a couple of things I'd just like to clarify on this. First is research is not a requirement for IRCP. Secondly, research is actually not a curriculum requirement. So if you look in the DCT curriculum, it doesn't mention research at all, although it does talk around quality improvement and audit. And even at specialty application, it only requires an understanding of the principles and relevance of evidence-based practice. So the first bit is it's not essential to have research. However, an understanding of research is very useful and it should be encouraged. And this really can be in any field discipline, not just in dentistry. So I'd just like to highlight that actually, if you were interested in research, it can happen anywhere. It doesn't have to be in a dental teaching hospital or a dental school. Secondly, a lot of the senior trainees will be involved in some form of research project, and it's always very useful to speak to them and try and tag on to anything that they're doing, because that will give you some exposure and a bit of experience. I'd also suggest your educational supervisors would be very useful to talk to, and one of the options is getting a little bit late in the training year, but is to try and incorporate that into your PDP, and then that will highlight that you're interested, and hopefully we'll get some traction and they'll be able to support that. The other thing I'd say is actually this is all part of your adult education. And it's about you choosing what you want to take part in. So if research is something that you have a real interest, then certainly try and make contact with people who can help you, but don't do it just because it says it's ticking a box, because that isn't the case for DCT. And so my advice around that is just talk to people, take their advice, and ask if they can support you on that. The second question is asking that all elective surgery has been cancelled, so we've hardly had any theatre time. Surely the number of SLEs we need should be reduced to reflect this. Theatre is one of the only times we have a one-to-one with our seniors, so it is when most of our SLEs are carried out. Again, thank you. That's a really useful question. Just to clarify, SLEs are supposed to have a breadth to them, and they're supposed to be done over a range of settings, so not just in one place like an operating theatre. Probably in an operating theatre, if you're doing DCT, that's really going to be restricted down to DOPS. Now, as Rachel's presented, for the IRCP, we're asking 12 SLEs, and there is no qualification about that. It's not saying they have to be done in any particular subject or against any particular competency. That will be different, as the slide is showing on the screen, for the FRCP, because there will be 24 SLEs, which have been divided up into at least 8 DOPs, 4 CBDs, 4 KEXs, and 1 clinical trainer. So if your exposure data to your supervisor has been entirely in theatre, can I suggest that you make it a priority to speak to your TPD and take their advice, because you should be getting your education over a wide range of opportunities, and that will include working through the outpatients, even if you're doing telephone triage and your on-call periods. These will all give you the opportunity to do work-based placed assessments. On a similar vein, the third question is, what are the expectations for dental training as we're asked to help in the ICUs during the COVID-19? And first off, absolutely, we know that in some areas people's training has been significantly disrupted because of the COVID pandemic. But as we alluded at your induction in September, at the time when there was minimal disruption, we were saying try and maximize out your training as much as possible at that point to try and anticipate any surge activity. However, training in redeployment does give you transferable skills that can be used in evidence for your IR and FRCP. I looked at the dental core portfolios at the weekend and noticed that the number of SLEs recorded nationally ranged from 0 to 26 at the current time. So again, it's probably worth asking around your colleagues, are they managing to achieve their SLEs? How are they doing it? But it's also been reported that you're more likely to get your SLE signed off if you are in deployment rather than in your own department sometimes, because they value having you there. So think creatively, and again, don't worry about asking. And because we are not asking you to do specific competencies for DCT, then your learning events through your transferable skills from redeployment will be counted. And then the fourth question is, what would happen if we don't meet all the requirements? Can a foundation dentist still do DCT afterwards? Well, I think this is an excellent question. And this is really the reason we've put in the COVID outcomes. And I'd probably address this in 2 ways. The first is for anybody who is currently in a DCT post, and they did DCT last year and had a COVID outcome. As Rachel says, really we're asking you to try and remove that COVID outcome by producing evidence by November time. If you haven't done that, then please make that a priority, because if you're applying to move on to another training post, you may be asked to produce all of that evidence. But the second part was, if you're a current FD and you have a COVID outcome, can you still progress to DCT? And the answer is, if it's a COVID outcome that you've got, yes, you can progress to DCT. You just have to be mindful that if you were to return to primary care at any point and you wish to join the performance list, you would need to address that outcome first. If you knew where your career trajectory was going and you were going to continue into some form of specialist field and you were not intending to move back into primary care, then that's probably less important. But what I would say is, if you do get a COVID outcome at IRCP as a DCT, then you still have 7 months to try and address that. And that is worth a conversation within your training unit, so that you can actually get their support to help you. So thank you, Rachel, and I'm going to pass over to James now about specialty.
My name is James Spencer. I'm postgraduate dental dean for Yorkshire and the Humber, and I'm an orthodontist by background. So as has been already said, and as you're all aware, COVID is having a significant impact on all our lives, and it's having an impact on our on your training lives. So we're fully aware of this, and what we do recognise is that this is going to have potential impacts on your training progression and your ability to sit the examinations. So what I'd like to do is hand over to Claire Wilson, who is one of our oral surgery trainees here in Yorkshire and Humber, but also doing a leadership fellow at the current time. Claire, over to you.
Thank you, James. So In the rest of the specialty trainee section, I'm going to cover a recap of our COVID outcomes for DSTs in 2020. We're going to talk through the 10.1 and 10.2 COVID ARCP outcomes and what they're going to mean for you, how the ARCP panel runs this year and training extensions. We're going to look at some documents that you need to complete prior to your ARCP and recommended actions for dentists in training who are redeployed, and finally where to find some additional information. So just a reminder before I start that you're going to be able to review this on catch up, so don't worry if you're not able to jot anything down as we go along. So this is a table that summarises the percentage of trainees awarded COVID outcomes up until November 2020, and you can see that, as you would expect from the experiences on the ground, the COVID-19 pandemic has affected dental specialty training progression for many of us. Although we're not struggling with the same battles as before, some dental trainees are currently redeployed. Many of those not redeployed are experiencing rota changes to adapt to the different circumstances in which we find ourselves and are having to be more proactive and self-directed with identifying opportunities to facilitate their training progression. This is a challenging time to be in training, and we know that this is causing anxiety for many trainees. But national guidance is very much that training should be actively continuing and prioritised as much as is practicable. So I'll now summarise the guidance for upcoming ARCP that specialty trainees need to be aware of. So firstly, the COVID outcomes that were created last year remain available up until the 30th of September this year for the ARCP panel to use at their discretion following their review of a trainee's portfolio. These are the 10.1 and 10.2 outcomes that are outlined on this slide. It's important to be aware that these are no fault outcomes and have been created to acknowledge that COVID-19 has had an impact on individual trainees' progression. They are not there to blame the trainees. The 10.2 outcome refers to a situation where COVID has impacted on a registrar's training when they are at a critical point in their progression. So, for example, at the end point in a training post, such as the end of ST3 in oral surgery or ST5 in a run-through training programme like restorative. In contrast, a 10.1 refers to a situation where COVID has impacted on a trainee, but they are not at a critical point in their training progression. For example, this may be appropriate for some trainees who are mid-training. Because these trainees are not at a critical point, there is a potential that the training deficit could be resolved later in the training if things with COVID improve. So, however, it ensures that this COVID impact is acknowledged within their portfolio for future ARCPs. So if a 10.1 or a 10.2 is awarded for a specialty trainee, there will be supplementary C codes applied to outline the nature of the training disruption, which you can see on the slide here. Multiple of these can be applied as appropriate to that trainee's individual circumstance. I should also mention that the normal ARCP outcome codes are also still an option for the ARCP panel to use. For some trainees, COVID may not have significantly impacted on their training at this stage, and therefore the additional 10.1 and 10.2 codes may not be applicable. The current position from the Dental Gold Guide and COVID guidance is that all ARCP panels will be conducted virtually with a minimum of 2 panellists, but without the trainee present. Every effort will be made by the local teams to run their ARCPs. However, in circumstances where this is not possible to convene the 2-person panel due to COVID, trainees would be awarded an outcome N13. Feedback on the trainees to the trainees following this meeting of the ARCP panel should be offered to them in a timely and supportive way. So, following that panel discussion, a trainee has a right to request a review of an outcome 10.1 or appeal against a 10.2. There is guidance on this from May 2020 that's available on the National Health Education England COVID Trainee Information website, which is on this slide. Alongside, there are also some other relevant COVID documents for dentists in training. So if a trainee is awarded an outcome 3 but believes that they should have received a no fault 10.1 or 10.2, then they also have a right to appeal this decision. It's not appropriate to make a blanket decision on extensions to training, as every trainee's situation is unique and therefore requires an individualised assessment by your ARCP panel to make this individualised decision. It's recognised by the dental deans that for some trainees an extension to their clinical training time may be appropriate. The situation is likely for trainees receiving 10.2, whereas a 10.1 would not result in a training extension at this point in time. The decision of whether trainees will receive extensions and by how long will depend on the individualised ARCP panel assessment. So the guidance has been updated recently to reflect that trainees may require longer extensions to training than in non-COVID times. Previously, the Gold Guide advised that trainees should be allowed up to a maximum of 12 months extension to training unless in exceptional circumstances. It's been recognised that this may put some trainees at disadvantage if they've already had an extension in their training prior to COVID. Therefore, although extension for the majority of trainees is expected to still be less than 12 months, this has been increased to a maximum overall of 24 months extension to training unless in exceptional circumstances. Any COVID related extensions would be included within that 24 months. So the next slide shows some documents required for your ARCP in addition to your portfolio being up to date. The first thing, the COVID-19 training disruption notification form, is a really important document for your ARCP panel to review, and this will be used alongside the final report within your portfolio from your educational supervisor. These will document the impact of COVID-19 on your training. They are an opportunity for you to provide the panel with the information to aid their decision making, so we'd strongly advise you fill it in carefully and as completely as possible. The other documents are the same as what is normally required. All of these documents are available on your regional deanery dental web pages and are expected to be included by all trainees at all stages of training. So some trainees have been redeployed since their last ARCP or may be currently redeployed. Record keeping and maintaining a focus on education and training where possible in any redeployment is encouraged. Updated guidance on accrediting trainee experience during redeployment suggests that methods of trainees to ideally keep a contemporaneous record of any activity. Much of this can be included in the COVID-19 training disruption notification form and also in addition in your portfolio itself. So if you require further information on your local ARCP process, here is the contact details for each dental deanery. In general training, as well as in preparation for your annual review, the dental deanery strongly advise you continue to seek out every opportunity to complete workplace-based assessments. There may be quality improvement research and virtual learning opportunities to aid your academic development, even if clinical activity is still affected in your workplace. Susie and I have both had our exams cancelled and subsequently sat our exams within this pandemic, and we can empathise with the challenges that trainees face, but the collaboration of trainees within units, regions and nationally to support each other in their continued learning and development has been a really positive effect to come out of this pandemic so far. I'd urge you to continue to communicate and check in with each other, as well as maintaining a dialogue with your educational supervisor and your training programme director, as these connections are vital when we are still under lockdown and social distancing measures. Susie will touch more on what's available to support your mental health and wellbeing as we continue to live and work through this pandemic. But for now, I'll pass back to James Spencer, who's going to answer some of the specialty training questions that have been submitted to the webinar.
So we've had a number of questions. First one, we may not be able to use our study budget this year. Are we allowed to carry it forward to the following year? Study leave is managed in different ways in each deanery. For some, it's dependent on what is agreed in your PDP, and others have a study leave budget. If there is an annual budget, this will not be carried forward, and I would suggest that you discuss your requirements with your TPD in your next training period. We have a question from an ST3 in restorative. Through the last year, despite working clinically, I do not feel we have progressed with many competencies due to the understandable challenge with treatments, disruption to referral pathways, and undertaking clinical activity. Should there be a need to identify further training, will this be supported with extra time? Well, as Claire has said, there is the ability to have your training extended. If you need extra time because you've not been able to gain the expected competencies at the usual rate due to COVID, this will be granted by the ARCP panel. This will be determined by them, and it has been agreed, as Clara said, that this can be extended up to 24 months. A similar question: how can someone be awarded a CCST without extension when they've had 12 months of their training disrupted? Well, the important thing to remember is that the requirements for the Outcome 6 have not changed, and it is expected that those trainees will still have to satisfy these requirements. The examination, WBAs, have a satisfactory ES report, clinical activity, etc. But you've got to recognise training as a continuum. You'll have been in your training for a significant length of time, and you may have been significantly ahead of the curve in terms of your trajectory, and then have now had that affected. So make every opportunity to continue to progress with your training in the non-clinical aspects. On clinic, as has been said, you'll be able to pick up competencies and do any activity that you can. Make every attempt to use this time also to do WBAs and take all learning opportunities. But the simple answer is you will still need to reach the same standard of training for us to think that you're appropriate for award of an Outcome 6 and recommendation to the GDC to go on the specialist list. Got another question. Will trainees in this cohort be disadvantaged due to not being able to reach sufficient logbook numbers for CCST? So again, this is a similar question, a similar theme. We can obviously see that there's a lot of concern about the amount of clinical activity that's going on. It is recognised across both medicine and dentistry that COVID has had an impact and decreased the normal clinical activity that you would have undertaken. But you still have to show competence to be signed off at CCST. I would like to say that numbers aren't everything. There's always an argument about, is it the amount of numbers or is it competence? And it's absolutely not just the simple numbers that lead to this decision. You will have the opinions of your very experienced trainers, your clinical supervisors and your educational supervisor feeding into the ARCP process to ensure that you're the right standard, and just encourage you to take every opportunity you can to undertake that clinical activity. Thank you. Those are the questions, so I will now hand over to Susie, who's going to talk about wellbeing.
Hi, my name is Susie Welford. I'm an STR in Paediatric Dentistry and a Leadership Fellow in Yorkshire and the Humber. So this past year has been a very challenging time for trainees, and the impact of the pandemic may have increased people's worries about training, work pressures and affected personal lives. For many people, their normal support networks may have been disrupted, so I'm here to remind you that if anyone is struggling in any way, there are support options available to you. Occupational stress is common among the dental profession, with risks of burnout and mental ill health. Previously, there has been a reluctance to discuss mental health issues and seek support, but we hope that this is now changing. There is greater recognition of the value of wellbeing in healthcare workers, and more support and resources are being made available. It's important to have time to switch off from work and current events and recharge your batteries, as difficult as this may be to do. It's important for everyone to prioritise our own wellbeing and mental health needs. For some, this may just be getting the basics right. The charity Mind and NHS both suggest 5 evidence-based steps to improve your wellbeing. These include connecting with other people, being active, learning something new, giving to others, and mindfulness. There are suggestions for ways to do this and resources in the newly launched Wellbeing Support for the Dental Team. They give strategies and resources for managing stress, poor sleep, anxiety, and low mood, with links to Public Health England's Every Mind Matters. This document also has links to support services on a range of issues, not just on work. There are also a number of apps that can be helpful, such as Headspace, Unmind, Daylight, and Sleepio, amongst others, and many of which of these are free to NHS staff. But we realise that for some trainees, they may need more than just these self-guided resources. There are many ways to access support, and these can vary across the country. Most trusts have services which you're able to access, and I'm going to discuss some of the support that HEE has available to you. So coaching may be helpful for some trainees, and it's not just for the times that you're struggling. Coaching provides time for you to think and talk things through without being judged. Your coach won't give you advice, but will help you to think things through in a way that's different to talking to a friend, partner, TPD or educational supervisor. They'll support you and challenge you if necessary to reach a conclusion that's helpful and meaningful to you. In most areas, you can access coaching through the Professional Support and Wellbeing Unit. In the North West, it's through the Mental Wellbeing and Resilience Training. And in Yorkshire and the Humber, you can book coaching directly through the HEE website. This slide shows some of the resources available in each area. And it may be a bit much to look at now, but this webinar is recorded so you can come back and look at more detail later. If you find yourself struggling, it's really important to discuss this with someone. For most trainees, your first point of contact is speaking to your educational supervisor. If for any reason you don't feel able to speak to them, you could talk to your training programme director, or another contact for those working in an NHS trust is the Director of Postgraduate Medical Education. Once you've discussed any concerns or problems, this person will be able to guide you to the most suitable support for you. For many areas, this is through the Professional Support and Wellbeing Unit. In some areas, it's known as the Professional Support Unit or the Trainee Support Service. Through these, you may be referred for coaching, mentoring, mental health support through counselling services or occupational health support. Most areas do accept self-referral through the Professional Support and Wellbeing Unit, but they do recommend that you go through your local educator first, your educational supervisor or TPD, as they can help direct you to the service that's most relevant to your needs. In addition to those, those working within NHS trusts will be able to access trust services. This can include occupational health services and mental health support such as counselling. You'll be able to find out more through your local trust intranet or through your occupational health services. There's also additional support available for dentists in both NHS and private practice, which can be sought through practitioner health. This gives access to GPs, psychiatrists and psychologists. For those who are needing immediate support, the Samaritans have a 24-hour helpline, and the NHS also has urgent mental health 24-hour helplines. Your local service can be found here by the link on this slide. Other options are speaking to your GP or calling NHS 111. The Dentists Health Support Trust can also provide help and support for any UK dentists experiencing mental health difficulties or facing problems in relation to alcohol or drugs. Our most important message is if you are struggling in any way, please do ask for help. It's a challenging time that affects us all differently, and there are people who will want to help you. Starting conversations about your health and well-being can be the first step in getting you the support that you need. Now I'm going to hand back over to Jane for some of the questions and answers.
Thank you very much, Susie. We have had quite a few questions in. I'm going to start, hopefully some of these have been answered in the presentation, but the one that kept coming up, which I'm going to ask Peter just to reiterate, is I presume it's for foundation training. Are FRCP requirements being altered in light of COVID in respect of UDA and clinical numbers of treatments? Peter.
Thank you, Jane. As in my presentation, I think we have a UDA target for the IRCP that's been agreed. I think that there is a period of review and reflection in relationship to the FRCP requirements, which will be announced after the IRCP and after relevant review by the dental advisory, the advisory group, and also it will need to be approved and agreed by the deans. So at the moment there is nothing to announce in relationship to FRCP requirements for dental foundation training.
Thank you. Another question here. Our oral surgery hands-on day was cancelled with no news of when this will be arranged. Do you know when this will be arranged? Right, I can't say I know when it's going to be arranged for you specifically, but I can say that anything that's been cancelled, we will be working hard to rearrange it if at all possible. And it is, once restrictions are lifted slightly, I'm sure those hands-on days will be taking place. So you need to speak to your local training programme director to find out what's happening there. Let's just go down. James, could I ask, I think this is one for you, how can someone be awarded a CCT in specialty training without extension? when at least 12 months of clinical training has been disrupted? And you've sort of, I think you touched on that, didn't you?
I've covered that, Jane. The other question.
I'm just going, sorry, I'm just drawing down.
The other question that has been raised about specialty is, well, I think it's about all trainees really, is why aren't trainees at ARCP? ARCP is a well-defined process where the evidence regarding your training is reviewed, and as such, trainees aren't actually involved in the ARCP panel. Feedback from trainees as part of HEE's wider ARCP review showed that trainees found the ARCP process stressful. They found it a tick box exercise, and there is confusion around where they sit within it. The important thing is actually the feedback that you received after your ARCP, and our recommendations are that this is supplied to you in a timely manner from your ES, your TPD, or your Associate Dean if you're getting a developmental outcome. Thank you.
Okay, another question here. For trainees who were redeployed, will there be appropriate extensions to training? There are discrepancies between deaneries with COVID outcomes. The first half of that question, obviously there will be appropriate extensions to training if they are required, if people haven't met the curriculum requirements, apart from DCT at the current time, because that doesn't have an extension to training. The discrepancies between deaneries with COVID outcomes, I think there will be discrepancies because COVID is impacting differently in different regions, if that was the tone of the question. Otherwise, we should all be using exactly the same outcomes as explained today. So I'm just scrolling down. Peter, this is one for you. Should isolation due to household COVID positive tests be recorded on the DFT portfolio as sick days or not recorded?
Thank you, Jane. It should clearly be recorded, and it should be recorded as what it is. It is isolation in relationship to COVID governmental advice. It will be very important it's recorded if information is going to be fed in for the IRCP in relationship to potentially a COVID outcome where there are unmet IRCP requirements. So yes, the answer is yes, it should be recorded, but it should be recorded for what it is. It is self-isolation in a household as a result of government guidance.
And I think another one for you, Peter. For interim RCP, do we complete a generic ES form or the review of competency progression ES report? I do not have an interim review of competency option.
Yeah, my understanding has been a lot of development on the Axia portfolio, and actually I think the ES report will involve automatically the supplementary report, Jane, for the IRCP. The education supervisor report is going to be very important for all trainees at this particular time. So the supplementary report will be part of the reporting process for the IRCP and for the FRCP.
And another one for you, Peter. What happens if our practice are unable to accommodate us to gain maximum clinical hours, which leads us not meeting our IRCP targets?
So again, I can't comment on individual circumstances and really just about processes. So I think that there will need to be health education in England will be working very closely with the practice. There is a contractual requirement of the practice to provide training and education hours of service. And my hope would be that there would be a collaborative agreement, Jane, in relationship to HE working with the practice to try and improve that situation. Because as you've already mentioned, for all of our training cohorts, it will be important that people do achieve their requirements for panel assessments. If it's not possible, then obviously wherever that was happening, there would be the ultimate option would be to engage another training practice to add or top up the training or to move to. But that should be the last option. Hopefully there should be a collaboration and agreement between both parties to try and improve those hours, which is a contractual situation between HEE and the providers of education.
And just time for one more question. I think this is about, do the same measures and outcomes apply to ACF trainees? Well, we do have ACF trainees at both dental core training and specialty training level, and obviously the same outcomes apply to them as well. There is no difference for the clinical training. The ARCP is related to your clinical training. Okay, I think I'd just like to thank everybody. I thank all of you for attending this evening's webinar. I hope you found it useful, and if you have got any suggestions for future webinars, do put them in the questions box. And I'd also very much like to thank all our speakers for giving up their valuable time this evening. So thank you very much, and a good evening to everybody.